Quiet on the set. Here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. That's BuckeyePMR.com is the website. All our radio shows are on there. But I'm here today. I'm really excited. We are going to be talking about stem cell procedures and regenerative medicine. That's something we specialize at Buckeye. And I actually brought a patient. We're going to talk about how her experience was and how she did. And she's kind of unique too, because she did have one knee replacement. Didn't want to have two, which we'll talk a little bit and talk about how we were able to help her out with some of the stem cell procedures we do at Buckeye. So we'll cut the break and be right back.
You ready?
Mm-hmm.
Okie dokie. She's always ready. Here we go.
Hey, this is Dr. Buzz. I'm back. I'm here with Jan. Hey, Jan, what's up?
Not much.
Jan's
Glad to be
shy.
here today.
Jan's real shy, you can see. Well, you can't see, but no, she's not shy. Anyways. But Jan's a patient at Buckeye. We did a stem cell procedure on her knee. But I want to kind of start off and talk about you a little bit. So you were a school teacher for how many years?
Almost 37. Taught 37 years and retired, but didn't retire well. So I've been back tutoring for 12 years.
You can't give it up.
Nope. Can't get off that schedule.
And then you said you were teaching like elementary.
Right.
And do you think that had anything to do with your bad knees?
Oh, I would say. I spent a lot of time getting up and down and being on the floor, and for many years doing that.
Right. And then when did your knee start bothering you, would you say?
Gosh, I would suppose before the surgery I had, maybe 2-3 years before that. So
it was after you retired.
Yes,
from
yes.
teaching.
Mm-hmm.
And what happened? You just started having
severe pain. I could not walk very well, and it was.
Did you ever have an injury though, or was it just from wear and tear from probably getting on your knees and helping the kids out?
I did have a meniscus tear at one time and got that fixed, but I healed from that. So.
Okay. So then your knee started bothering you, and then what did you do?
Well, I went to the orthopedic surgeon, and he said, you will tell me when it's time that you want surgery if it's, messing up your life enough. So I believe it was 4 years ago. I went in and had my first knee replacement on my
Did you do any treatment prior to that, though? Did they do any?
No, not really.
So they didn't do like cortisone on you or anything like that?
No, not on that knee. No, not on my left. And so I had that surgery, the first surgery, got along fine.
That was 4 years ago?
Mm-hmm.
Okay.
A year after that, I got an infection in that knee.
And so you got an infection in the
left knee.
Artificial knee that you got? Wow.
Right. And so.
What caused that, did they say? Why did you get an infection
They did not know. I don't know. I asked that same question and.
You'd think an infection would happen right after the surgery. Yeah. It's kind of weird it would happen a year afterwards.
A year after, you would think so. So.
And what happened? How did you know you had an infection?
I had discharge, and when I was doing some physical therapy, and the physical therapist said, "Sit down. you can't do this. You got to go back to the doctor." So
did you end up? You were doing physical therapy because your knee was hurting you, the artificial knee was hurting you, or why were you doing PT a year after surgery?
Well, I didn't get it all done the first time, and so I went back and had some more.
So you're still having some problems with that knee. You went
yes.
back to PT. I got it. And then you started having some discharge, and that's when they're like, "Oh, something's going on here."
So I went back, and the doctor said, you have to have what they call a cement spacer put in. So I had another surgery. They put the cement spacer in, which had antibiotics in it.
So they basically put like some type of material in there with a lot of antibiotics.
Yeah, and I had a PICC line for 2 months. Did that, kept that spacer for a year.
Where'd they put the PICC line in?
My left arm, up in the top of my left arm, which was not pleasant, but I was able to do that twice a day. I had to give it antibiotics twice a day. So then I kept that for a year. Then the next summer, I went back and I had the spacer taken out and then put a knee replacement in there.
They had to replace the whole knee?
Yep. Whole another surgery.
Why was that? Just because that was a problem with that knee or something?
Well, the spacer, they had to take the spacer out. That was not a permanent fix. That was just to clear up the infection.
I gotcha. Wow.
So, but I got along fine with that. I've gotten along fine with the new replacement.
Okay, it's been about a year out from that one there.
Yeah.
And you're not alone. According to the Journal of Orthopedic Medicine, 50% of people who have knee replacements have to go back and have other procedures done. So,
I was not aware of that.
Yeah, so you're not alone. I mean, I think what you went through is probably a little more traumatic than most, a PICC line and all that.
Oh,
I mean, you could have died. I mean, but I think a lot of people unfortunately think, and I hear it all the time, people come to the office and say, I'm just, my doctor, same thing, I'm going to have it no matter what, so I'm just waiting.
Right.
And I hear that all the time, and there are other options out there. So and that knee is okay. Now you said you have a little bit of pain still in that artificial knee.
Yeah, down below the knee. Nothing in the knee, the knee proper in that joint, but I have
maybe where they attached it or something down there. I'm thinking
something.
Okay, and then you started having pain. So that's your left knee. You did the replacement on, had all the issues. Then your right knee started having pain, and then I forget how we even meet. Did you come to a seminar?
I did.
Or?
I came to a seminar. I saw it in the paper, and a friend of mine and I decided we were going to go to the seminar in Grove City, and we went and made an appointment and came in and started the process.
Okay, awesome. And then in your situation, we used stem cells on you. I think we used stem cells, platelet-rich plasma, and ozone. We used a little bit of everything on you because you were pretty bad. You were bone on bone.
Right.
For people listening out there, you know, how was the experience? Like, I mean, compared to knee replacement, how's knee replacement compared to a stem cell procedure?
Oh, stem cell is much better. I was teasing the doctor that gave me the stem cell. The worst thing was for the first 2 weeks, I could not. You had to cut back on your caffeine, and I would say that was the worst. The injections were not bad. I did not have any trouble with that. So it's much better than a knee replacement.
Because what's rehab on a knee replacement? Like, what was your process on that?
Oh gosh. Well, right after they get you up right away when you have the surgery, the same day of surgery. Then I was in the hospital for 3 days. They did some small amount of rehab there, but then I went to a facility afterwards and was there for a week, and I had intensive rehab there. And then when I came home, I did outpatient for about, oh gosh, I bet I went about 8 weeks for rehab there. So it's pretty intensive.
Right. I mean, if you've ever, I don't know, did you YouTube knee replacement surgery?
No.
Okay, yeah, I don't recommend it.
I know.
Yeah, they literally cut your knee out.
Yes, they do.
I mean, the tools they use are pretty much like carpentry tools.
Yeah.
They're medical grade, and they pound it back in. That's kind of...
The worst one was the cement implant. That was the cement spacer. That was a terrible surgery. It was, the cut was real bad, and that was really hard. So the other two were not so bad, but that one was hard.
Okay. And then, you know, so basically, so you understand what we're talking about here. So she had bone on bone and would probably had to have another knee replacement.
Yes.
And I know some people will say, well, I'll never do it. The pain, I mean, how bad is the pain when you have a bad knee?
Well, it very much limits you. You know, I couldn't do stairs. I have a 2-story house, and my laundry is in the basement, and I have an upstairs. I couldn't get down and do anything with my grandkids, so it impacts your life.
Yeah, and the same thing, I mean, a lot of people say, I'll never have back surgery, hip surgery, knee surgery. If you have a degenerative condition, if you have pain for somewhere longer than 3 months, that means you have inflammation there. And if you have chronic inflammation, the joint does wear out. Right. And you might be listening and saying, well, I'll never do that. But the pain will get to the point in the loss of function, you'll have to do something.
Yes.
You know,
yes.
And unfortunately, a lot of people, it doesn't sound like you did a lot of it. Well, what they'll typically do is they'll go to the doctor, they have knee pain, they'll get a cortisone injection, which you said you didn't get any of those.
Not in that leg, but I did in the right leg. I did that for a while, but then that wears off. It doesn't last after a while.
Right. And what a lot of people don't realize, too, is that cortisone injection, you're only allowed to get 3 a year.
Right.
So the first warning, if something you're only allowed to get 3 times a year, is probably not a good idea.
Yes.
But what a lot of people don't realize is when you get that cortisone injection, every injection causes up to 8% bone loss, and it weakens the tendon and weakens the ligament. And I know firsthand myself, I had a cortisone injection in my shoulder when I was in college. And to be honest with you, when I first got the cortisone injection, I felt really good like 2 days later. I was like, man, this is a miracle. And this is before I had gone to school and knew anything about anything. But I ended up, a few months later, I tore my pec. So what happens is when you get that cortisone injection, it weakens the ligaments, weakens the tendons, and in my situation, it weakened the tendon attached to my pec, and that led to a much bigger problem. So, but the same thing happens if you're getting knee injections, shoulder injections, back injections with cortisone or corticosteroids, you're destroying the joint.
Right.
You know, and really one of the only things that you can't do before you go to Buckeye for a stem cell procedure is if you have cortisone in that joint for 6 weeks, we can't touch you.
Yes, and I had to wait.
You did have to wait?
Yes,
okay.
I did.
Because if we put live cells in there 6 weeks after cortisone, it kills them immediately. That's how strong that stuff is.
Right.
You know, so what you got to think of is we're all undergoing stem cell therapy. You know, the way the body heals is that when you have pain somewhere, your body and those cells there are dying. And if you have a degenerative condition, the cells are dying quicker than being reproduced. And what happens when those cells are dying, they send out, the way healing works is pretty amazing. Your cells that are dying send out a signal. It's called a paracrine signal. And what that's doing is it's calling for help. And we all have stem cells. If we didn't, we'd be dead in a couple days. So if we get, so we're all healing as we sit here now. It calls your own stem cells to that area, and they attach and they release their growth factors to heal that area. The problem is, we get older, we have less stem cells, less growth factors, and that's why as we get older, sometimes those aches and pains just don't get better and get worse with time.
Right.
So, so in your situation, you know, at Buckeye, we do a couple of different types of stem cell procedures. I think we're going to cut the break real quick, and we'll go over the different procedures we do, and we'll talk about how you're doing now. You seem like you're moving around pretty good today.
Okay.
This is Dr. Buzz. I'm here with Jan with Buckeye Physical Medicine Rehab. That's BuckeyePMR.com. Sorry, we have to go over 10 minutes.
That's all right. I can cough.
You were holding it in the whole time?
No.
Oh,
Shake cough and take a drink of water.
Yeah.
Jan, you're a pro.
Yeah, you're
Good.
doing a great job.
And I've got my face right up to the microphone.
Good, you're doing a great job. Sounding good. Dr. Buzz, I'm not sure. You're not sounding as good as you usually do.
no, I think Jan's overshadowing me.
Yeah, she's doing a
We
good
have to turn
job.
her down. No.
Ready to roll?
Yeah, I'm ready.
Okay, here we go.
Hey, this is Dr. Buzz. I'm back with Jan, who is speaking louder than me today on the radio. Anyways, we're talking about Jan's had a knee replacement on one knee, her left knee, and then she's done stem cell procedures on her right knee with Buckeye. We were talking a little bit about the different types of stem cell procedures we do at Buckeye. We're one of the only facilities, the only one I know of in Ohio that offers multiple types of stem cell therapies. And you know, and everyone's heard of stem cells. Did you hear of stem cells before you came?
Yes, yes.
Did
I
you
had
do any
research, a
did
little
you
bit.
research?
Yes, I
Okay.
did. I did a lot of searches on the internet.
Okay. And a lot of people, and when the cool thing about the internet is you can find a lot of good stuff.
Yeah.
You know, but you know, so you know, there's two types of stem cell procedures you can do, and we do both of them at Buckeye, and I don't know of anyone else that does both. One is called an autograft, and an autograft is we'd harvest your bone marrow or your body fat, your adipose, get the stem cells from your own body, spin it down, and re-inject that back into the area. Autograft is an older technology, and for some people, for religious reasons, that we have to do it. So we do adipose still.
Sure.
But the problem if we harvest your own stem cells is, number one, the older you get, the weaker your stem cells
Right.
are.
The older the stem cells are.
Yeah, and what people have to realize is what the stem cells are actually doing is they're feeding your cells. They're releasing growth factors. But the older we are, the weaker our growth factors are. So anytime you're doing an autograft of bone marrow or adipose, it's always limited to the health of the donor, which is yourself.
Right.
So, you know, that's why at Buckeye we prefer to do what they call an allograft. And an allograft is from a donor.
Right.
You know, the allograft tissue we use is we either use placental allografts, which are people that have elective C-sections, or we use cord tissue, which I think we use cord tissue in your situation,
think so,
which
yes.
that's the best. Cord tissue is from people that have live, healthy births, and they donate the umbilical cord.
Right.
And that umbilical cord is loaded with live, healthy, what we call mesenchymal, which are tissue stem cells, which is what we use in orthopedics. You know, and each injection has 500,000 live cells. So it's pretty incredible. So what we do in her situation, when you're bone on bone, her body obviously wasn't healing like it should, you know, and probably because she had less stem cells and they were weaker. That's what happens as you get older. We introduce these, what we call day zero, these are baby stem cells, into the joint, 500,000 of them, to regrow tissue. So get the body to literally heal itself. And that's much different than taking cortisone destroys a joint. Which, you know, it might help with the pain short term. There's people that do like hyaluronic acid injections. Did you ever do any of those?
No, but I've heard about it.
You know, that's not as bad as cortisone, but it
Right.
never fixes it. We do those at Buckeye too. It doesn't destroy the joint, but it's like lubricating the joint. It never fixes it, and they last less as
Right.
time goes on. And you know, and obviously taking like an NSAID or an opioid, that's never going to fix it either.
No.
You know, so I guess if you're listening and you're having pain, you either have to do stem cells or regenerative medicine, or you're going to have to replace a joint. That's the reality.
That's right.
You know, so in her situation, and we combine that in her case. You know, she was bone on bone, which is the worst of the worst. We combine that. We use ozone therapy, and we also use platelet-rich plasma. And the way the platelet-rich plasma works is we drew blood out of her, and your own blood has growth factors in it. And what we do is when we put the stem cells in first, those stem cells are there and they're feeding your cells, and then we put your PRP on top of it. It's like fertilizing seeds.
Right.
So we fed the stem cells we put into her knee with her own growth factors, and that supercharges it. And we also combine that with ozone therapy, which is pretty incredible. And ozone is simply O3, oxygen's O2. But O3, which is is ozone, is a very unstable molecule. Oxygen molecule, it's 3 oxygens on an electron. They don't like that. So, but when you inject that into a joint, what happens is that extra oxygen molecule falls off and really oxidizes that area. And oxidation is what causes cell growth. So it's pretty incredible. So if we just inject oxygen into a joint, it's stable. The oxygen molecule doesn't fall off. Nothing happens. But that O3, that ozone, really causes your cells to proliferate and grow and release more growth factors. And it was a combination of those things that help us get a result. And so how's your knee doing now? You're 3 months out.
3 months out, yes. Much better. I know the pain from bone on bone because I've had that, and I'm back to doing some activities now, and I'm back to having caffeine, not overly.
That was the hardest part for you.
That was the hardest part for me, yes. The needles were not bad. The caffeine was the problem. But I'm getting along very well. We've not done an x-ray yet to see the bone growth, but that's coming, I guess.
Yeah, the cartilage growth. And usually these stem cells in this whole procedure, it's different. If you've had a cortisone injection, usually you get the cortisone injection and the next couple of days you might feel better.
Right.
But then it wears out over time, so you didn't really fix anything. But with stem cells, these things we really don't even like to take x-rays until 6 months because they're growing and proliferating and the body's healing for 6 months. So at 6 months, we kind of say that's where you're going to be.
Sure.
So, and the other thing I think is important for people to understand is with stem cells, you're not going to have to come do it again next year.
Right.
We're not going to, like your other knee where you had to have it redone. You don't redo stem cells. We put them in there, they're good. Obviously, if you had some major trauma or something,
Sure.
it's possible. But we've done over 200 of these allografts at Buckeye, and we've never redone one.
Mm-hmm.
So that's something you shouldn't have to do. Maybe you come in and do a tune-up with a PRP or some ozone. We talked about that a little bit. But pretty much you should be good to go. It should last you another
long time.
But
I
as
hope.
long as you want,
Right.
as long as you want.
Right.
People always worry about the discomfort too. So you had a cortisone injection, you had a stem cell injection.
Yes.
Which one's worse?
Well, I would say probably the cortisone. I did not, and I don't know if I have a high tolerance for pain or what, but I did not have a problem with the stem cell injection. So cortisone kind of hurt. I had that in my hand as well. That really hurt in my hand, so the cortisone shot.
Did we put stem cells in your hand too?
Yes.
We did? Okay.
Yes.
Where'd we put it?
Right below my thumb, right by my thumb.
So you had a cortisone injection there first.
Oh, yeah.
And that didn't work out. Then they put some stem cells. How's that going now?
Better.
Okay.
Much better, yeah.
When did we do that one?
That's probably been about a month or 5 weeks ago.
Okay, so kind of the beginning stages still. Okay.
right.
Were you allowed to have caffeine after that one?
No, I had to stop again. Had a terrible 4 weeks there where I couldn't.
Yeah, and a couple things you're not able to do. So when someone has a stem cell procedure, pretty much what we say is the first 2 weeks after the procedure, we want you to pretend you had surgery.
Right.
It's very important to let those cells kind of settle in and start, laying down a scaffolding and start growing, which is hard for some people because a lot of people, I don't know about your situation, I would say half the people have a pretty significant pain relief almost immediately afterwards.
And they want to do a lot of activity. It said, the doctor said, if it hurts, don't do it.
Yeah,
You can try things, but if it hurts, don't
It's
do it
really
now.
important not to upset those cells,
Right.
especially those first 2 weeks. And the other thing we ask you to do for the first, at least for the first month, is don't take any NSAIDs,
Right,
non-steroidal anti-inflammatory drugs. We're talking about, Advil, Aleve,
right.
all these different things. And the reason you can't take these NSAIDs is NSAIDs also kill stem cells.
Mm-hmm.
So a lot of people might be listening to the show here, and if you're taking NSAIDs every day for back pain, neck pain, knee pain, shoulder pain, you're killing your own body's stem cells.
Mm-hmm.
On top of the fact that it's dangerous, those are only for short-term use. Last year alone, they said in the United States, over 20,000 people died from just taking over-the-counter NSAIDs for pain.
Right.
So you're not only inhibiting your own body's ability to heal, you're going to have gastrointestinal issues, kidney issues. So strongly recommend to stay away from that stuff there. And then, so what's your plan? So once this knee's 100%, what are you doing?
Well, I'm continuing to work. I'm doing much better with my grandkids now. I'm able to do more things with them, which is nice.
How many grandkids you got?
4. All
What
boys.
ages? Oh, that's easy.
11, 8, 6, and 11 months.
All right.
So
That's awesome.
We're busy.
And they all local too, so you can see them?
2 are down in Nelsonville, and then the other 2 are here.
Okay, that's fantastic.
Uh-huh.
And then you said you're still tutoring, right?
Oh, yeah. Mm-hmm.
Where do you get people to tutor? Just like
Well, at school, I go back. I'm back at the school that I retired from, and I work 25 hours a week.
oh dang, you're almost full time.
Just about. With no benefits. You just work that time.
That's fun. So then you're back there doing that. So basically, stay active with the grandkids,
Yes.
continue teaching. So you're back to work now, then, right?
Yes.
Okay, so you're back at that. And potentially your knee should be good to go now, and hopefully the left knee or the one you had replaced, we don't have any issues with that one.
Right.
But if you're listening, I just strongly recommend if you've been told you have to have joint replacement, knee replacement, back surgery, before you go through, any of these procedures, realize, number one, an artificial joint's never as good as the real one.
Right.
And
it's
then
not.
there's no guarantee. I think I mentioned earlier, 50%, this is not from me, it's from the Journal of Orthopedic Medicine, 50% of knee replacements have to go back for a second surgery. Half.
Mm-hmm.
1 in 400 people that has total knee replacement dies. So, you want to avoid it at all costs. Now, some people come and they do need knee replacement. I mean, we can't help everybody, but if you're listening, you can come to Buckeye. You mentioned the radio show. It doesn't cost you anything to come in for a consultation. You'll sit down with one of the providers there. We'll give you a half hour to 45 minutes of our time, one-on-one. Tell us what you got going on. Bring any x-rays, MRIs, anything you have. If not, we have those, x-rays facilities on site. We'll talk about your problem, and we'll shoot you an honest opinion if we can help you or not.
The seminar was very helpful as well. We went to that to begin with, my friend and I, and then made the appointment to come in for the consultation. So that gives you a good overview.
Yeah, and we do seminars. We try to do seminars. I never get out of the office. The office is really busy, so that's the only time I get to go out and talk to people. But we try to do seminars every other week. We advertise on Facebook and the paper. You can go to our website. We always list those seminar times there. So if you're on the fence and want to learn more and don't want to commit to coming to the office, you can come to the seminar. We feed you. I can talk all the time. So come and listen to what we have to say and see if it makes sense. But don't give up on yourself and your body's ability to heal, because if you're alive, you can heal. If you're alive, you can heal, and you have the potential to heal, whether it's your back, your knee, your shoulder. Before you replace it, you got to come to Buckeye to see if we could potentially help out. We're going to cut to break. I'm here with Jan, and we'll be right back. Just finish up with Mike, please.
Yeah, you only got about 4 or 5 more minutes.
All right.
So.
That's easy.
Well, her friend did it too.
Where's your friend daughter?
Yeah, in the back.
So she had it back. So
How's her back going?
Well, it was really severe. She had a lot of surgeries back there, but she said she wouldn't be able to walk her dog and do all those things if she wouldn't have that. I mean, she still has pain, but not near what she had. Carol Rude.
Oh, I know Carol. Okay, cool.
Yeah, she went up to Polaris and had whatever it was they had. So she's got a lot of hardware on her back. So.
Okay. Have they done ozone already? She should come to ozone.
Yeah,
Remind
I
me.
don't
That's
know.
something we just started doing. And
Okay.
we got really good results.
I hope that helps.
Something the
this
pro
leg.
athletes do, right?
Ozone's really, and we weren't doing that in backs, and we started, and the results have been really
I
good.
will tell her that then. Yeah.
Because the same thing, it just shuts out that neurogenic
Yeah,
pain.
yeah. Well, I'm hoping that's what this is, because that's terrible. It's this knee's great, but I
It
don't know.
sounds like maybe where they put they put a thing in.
I know.
Maybe
Yeah,
something there got inflamed.
And it started in the spring, right before school was out. And of course, I go back to the orthopedic guy to begin with, and he says, no, it's your foot. So I go into the foot person, and I've had
It's not your foot
MRIs.
if it hurts here.
Well, they thought it might be my ankle or the way my feet turn, because my feet were flat. So I got orthotics, I got an MRI, I got X-rays. I didn't know what it was. So
Wow.
yeah.
Did you go to the Good Feet store?
No, I
okay.
went to the orthopedic one guy.
Oh, okay. I've heard of them. I think both of them have advertised on our radio stations
Yeah,
over
I'm
the
sure.
years.
Yeah.
All right. Ready to wrap it up?
Yep.
Okay, here we go.
Hey, this is Dr. Buzz. I'm back here with Jan. We were talking about stem cells and regenerative medicine. And when on break, we were just talking about, you had come to the seminar with a friend of yours.
I had, yes.
And she had multiple back surgeries, or how many, you know what?
2 or 3.
And was her neck or low back?
I would say middle of her back. Yeah.
Gotcha.
Mhm.
And I think we did some stem cell procedures on her.
Yes.
And, how is she doing?
She's doing much better. She's able now to walk her dog for more time than she was before, and she still has some pain, but it's much less than what she had before.
Yeah, and backs are really complicated,
Yes,
unfortunately,
yes.
and there's lots of factors there. And usually with stem cells, it does take a little bit longer.
Yes. Mhm.
So, but it, obviously, if she's had a couple surgeries, she's not a good candidate to go back for another surgery.
No, that's what she wanted to avoid.
Yeah. So, and we were talking on break too. We'll probably end up doing some ozone on her back too, because anyone that suffers with what they call neurogenic pain, which is chronic pain, the ozone injections work really well to shut that pain off. And we were kind of talking on break too. The knee you had replaced
Right.
hurts you below probably where they put the knee into the bone.
Yes.
I would imagine.
Yes.
So we're going to hook you up with some ozone this week on that.
That'll be great. Because my other knee's not bothering my right knee with the stem cells. So.
Okay. So we'll get you there to do that. So I just want to conclude today by saying, Jan, I really appreciate you coming in here.
Thank you for having me.
And I'm sure your kids appreciate you still teaching.
Yes.
Yeah.
I hope so.
And then if you're listening, you've thought about stem cells, or does it sound too good to be true? No, it's not too good to be true. Our success rate is over 90%. And when I say success, people say, well, what is success? Well, if you're bone on bone, your knee's not going to be like a 15-year-old knee. I don't want to tell people that, but it's going to stop the degenerative process. You're going to have improved range of motion and function. And would you say your stem cell knee is better than the artificial one?
Yes.
Okay. Yeah.
At
So
this point.
yeah, at this point. So if you don't have to go through surgery, a simple procedure, and you get a better outcome, and there's much less risk, it just makes sense to see if you might qualify for this type of procedure. And we're doing it at Buckeye. Dr. Bain and myself are both fellowship trained in stem cells. We're the only people in Ohio. I don't know of anyone even in the country, but I'm sure there's someone that's offering the autografts and allografts. As I said, we've done over 200 procedures at this point, had amazing, amazing results. Chances are if you come in for a consult, there'll be someone there who's had the procedure done. You can ask them how it went. But you have nothing to lose. Mention the radio show, come in, we'll give you a half hour, 45 minutes of our time. We won't charge you anything for that to see if we can help. So you have nothing to lose. So that's pretty much it. I do appreciate you coming on today.
Thank you. Thanks for
Before
having
you
me.
go back, you go back to school today?
Probably not today. No, tomorrow.
All right, tomorrow. I'm going back to work, though, unfortunately. But anyway, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. That's BuckeyePMR.com is our website. Check it out, and hope to see you soon.
Excellent.
Whoa, we did it.
That one goes pretty quick, doesn't it?
Mm-hmm.